you recording it?
I
Yep.
know they are.
I'm recording it.
Oh.
They are, not me.
Can you tell us then later how we can get in there?
Yep. I'll give you all the there's no access code, but I'll give you the links on how to get to it. There's a bit of a glare on the screen, which is I might just have to deal with that later. I think we'll wait like 2 more minutes. I think we have a couple more patients that signed up.
Could somebody give me a sheet of paper, please?
I'll grab you one too. You got a pen?
Yeah.
Yep, we got one.
Yeah.
Yep.
You need something to write on, you have to get a book or something. You know, you have to write, you've got a bigger sheet of paper. It's easier to write than a small notes when you don't have something solid to put it on.
Well,
Yeah.
I think we have a few more patients showing up.
Thank you
But
so much.
we'll get started and everything, live streamed. And then that camera's gonna record it and then I'll chop it up into like 10 minute, 15-minute segments. So if you like, there's a certain section you wanna listen to, you can just tune in. That takes me a little while to get that up and running. That may take me a few weeks, but who did not get a coupon? You did not. What was your first name?
Kay.
Kay?
Thanks.
Yep. Did you sign up online or with Kelly?
Oh, gosh, a long
Or
time, a
I
while
can figure it
ago.
out later. What's the
Yeah.
last name?
Redmond, R-E-D.
Oh, Kathleen.
Yeah,
Yep.
Kat, that's why.
There we
It's
go.
Kathleen.
Okay.
Sorry, I don't
That's
go by
okay.
Kathleen, but that is my name.
We have
A nickname, huh?
Yeah.
3 more people that signed up.
What's
But,
your nickname?
Kay.
I have my.
Okay.
oh, yeah.
Yeah.
Yes. Yep. You're welcome. All right. I think I'm going to sit and do the presentation because it feels weird to stand with such a small group. So I'm gonna just-
Sure.
maybe I'm going to grab a little.
Yeah, this is the smallest group I've seen here.
I've never seen it. That's.
Yeah, I would think there'd be more people here, but maybe because it's so nice outside.
Could be.
Make it a little bit less formal and we can be a little more interactive.
My daughter-in-law, she's very young and she's got really problems with her hair, really thin.
Let me see. Actually, maybe I do want to get rid of this chair. I need an assistant, don't I?
Yeah, that's a little bit too low.
We'll get there. And we'll get started. All right. I'm just gonna sit here. Can everyone see that okay? You're right. I know. I'm kind of in
I can move
a little bit in the way.
That's good.
I think there's a few people signed in online at home. Yeah, we have 4 people. So welcome. They might not see me, but that's all right. You can hear me, I'm sure, just fine. You don't need to see my beautiful face. You just need to listen to the information. All right. So hair loss, genetic testing. So I was just telling
Me.
you, what was your first name?
Laura.
Laura, that, so I'm not a huge, as a pharmacist, a big drug fan. So I'm the anti-pharmacist, even though I own a pharmacy. So, but we're looking for natural treatments and so forth. But with hair loss, the nice thing that we have available to us now is genetic testing. So we can use pharmaceuticals in lower doses and use them in a way that's topical versus oral, and test your genes to see which drugs, before we try them on you, which ones are going to have a more favorable effect than others. And I think that's it, big picture outside of hair loss. Like, I think that's where, and we see this already in our industry, is you're going to do a genetic test to see if what blood pressure pill works best, or what cholesterol pill, or what asthma pill, or what glaucoma pill or eye drop works best. And then from that genetic test, then you'll get prescribed that particular medication because your genes are preferential to that drug or whatever drug. So the nice thing with hair loss, it does take time though. The turnaround time on doing this test until you get the results back, it's about 4 to 6 weeks. So it's not like a quick overnight thing, but at least we're getting better at individualized, customized therapy. Instead of trying a drug, seeing if it works, wasting a lot of time and money at it, now we have a tool to say, okay, let's at least narrow it down. All right. Yep. So you didn't miss anything.
Okay.
Still in the introduction phase here. The last two are here too. Now everybody's here. We should lock the door, right? No more. No, I'm just kidding.
Sorry. Jane and Sam.
Yep, perfect.
Thank you.
You are welcome. So that's the beauty of this test. And there's another test too we'll talk about with this company, that not only the genes that will tell us what pharmaceuticals you're more likely to have a favorable response to, but they have another test too that will show if you have any vitamin or nutrient deficiency, or I shouldn't say deficiency, but there's certain SNPs that'll tell you if you have an issue with vitamin A or vitamin E or vitamin C in metabolizing that and utilizing those vitamins. And if you do, then you need more of those vitamins or minerals. So we'll get to that too in a little bit. So that's kind of the journey that we're on. Is it's this very, very much customized therapy. It's not just going out and getting Rogaine for women and see if it works and have a bunch of side effects and that type of thing. It's very much systematic. Do you respond to this drug or not? Where we're going to do a genetic test to see if you do respond to it. And if you don't, let's keep peeling back the layers to find out what's the root cause of your particular issue for your hair loss. It's definitely not a one size fits all. So you can have 100 different patients all with quote unquote hair loss, and they all can have a different recipe, what works best for them. And so that's why it works well with compounding pharmacy, because we've been already doing this for about 3 months. We're customizing hair shampoos, conditioners, different serums. We'll go through that. I have a couple little samples we have a foaming solution that you can put on your hair at night, wash it off in the morning. That's going to help regrow hair, make it stronger, all those things that we want it to do. So, all right, so that's where we're heading to. I'm not a physician. Not that this talk doesn't probably pertain to some of the other talks that I give, but these are just recommendations to go back to your physician with. So liability-wise, you can't, my hair didn't grow back, so don't sue me, kind of thing. That's what that says. So we're going to talk about the TrichoTest. So that's the name of the test, TrichoTest. The company that we partnered with is Fagron. Not that these names matter right now, but it's a company that's been around in the pharmaceutical world for years. They supply us with our APIs, which is our active pharmaceutical ingredients, and they partnered with a genetic lab to provide the test. And with that, you'll provide a saliva sample, essentially, with the genetic test. I think I was telling you blood before, wasn't I? Or was that a different test?
No, that was for something.
That was for something else. I'm sorry. But it's basically a cheek swab for the TrichoTest, and they get your DNA, right? And then they look for SNPs. They look for specific genes related to hair loss or vitamin utilization, and so forth, and they kind of go down the line. And then that comes back, and that report will tell us, which is really nice. They've made it very simple for me as the pharmacist. They'll say, okay, this patient has these genetic SNPs. These drugs will work in this particular patient for these reasons. These ones won't. Here are some sample formulations. And then here are some bases or shampoos or creams, whatever it is, serums that we're going to put those drugs in to have the patient put on their scalp. So it's very neat that way. And then the nice thing that I like with topical application, well, we do a lot of hormones here. I think most of you know that about me already. We do a lot of bioidentical hormone therapy for women and men. It's a lot, in general, I'm speaking in generalities here, it's more effective and safer to put hormones onto the skin. And I relate a lot of that to the hair care solution. Instead of taking a drug orally that goes throughout your entire body to treat hair loss, we're going to put it right on the scalp to treat hair loss. So I can use a much lower dose. And when I use a much lower dose of a medication, I'm going to have a lot less risk for side effects. And that's huge. So that's what we're going to get into. So I'm just going to read this out loud. So TrichoTest is the most complete genetic test to date. I'm sure hopefully it advances, but as far as our research has gone so far, to treating alopecia and hair loss, analyzing and taking into account both genetic factors and other relevant patient characteristics. And so we're going to dive into that for probably the next 15 minutes or so, and then we'll spin off into some other factors as well. This is just a general outline of, and this isn't all-inclusive, but this is the list that I came up with for this talk, that when we're talking about hair loss, these at least at a minimum should be on your list of, okay, let's go through this one by one and see if, is there a genetic issue for your hair loss? Well, how do we figure that out? Let's do the test and see if that's true or not. Do you have a bunch of SNPs that are creating your hair loss? If you don't want to do that, there are other options too. You could look at androgens and hormone changes. So we treat a lot of women here for thyroid issues and menopause issues. And I sit in that booth, 8 hours a day, talking to patients day after day. I've been doing this for 18 years now. And you hit menopause, and it all goes to hell. Am I right? Okay. That's what I hear, anyways. It's more than that, of course. I don't want to minimize anything, but that's what I hear on my end from the pharmacist. So, we'll talk about this too in a minute. But a woman's progesterone and estrogen levels drop. We all typically know this. And then what happens is, comparatively, their androgens, they haven't gone up, but from a ratio aspect, they have. And hair thinning and loss starts to develop, unfortunately. So let's look at that, and we can test that, and we'll look at that in a minute too. Inflammation, every time I give a talk, no matter what disease state it is, inflammation is somewhere always in there, right? So we'll talk a little bit about that. I'm not going to dwell on that topic too much tonight. Blood circulation, Carol, I think you just mentioned that just a moment ago. We'll talk a little bit about blood circulation to the scalp. Actually, you can measure indirectly just circulation in general. And if you have low nitric oxide and you have poor oxygenation to the scalp, you're not going to grow hair very well. It's going to be very challenging. So let's measure that. How do we figure that out? That's at least, think of these as check boxes and say, okay, do I have a blood circulation issue? Do I have stress? So on and so forth. So let's kind of go through these and at least check off these boxes to see which one of these is the root cause for your particular problem. We'll talk about stress, pollution. Again, there's another test with that same company that provides us with the TrichoTest that can actually measure if you have SNPs that predispose you to not utilizing vitamin E or vitamin A or vitamin D as efficiently. Or maybe you have a SNP that you don't produce enough CoQ10 compared to, quote unquote, the average. So maybe you need some more CoQ10 and some more ATP to produce energy to help with circulation, that type of thing. So we can really get deep into the weeds with some of this testing now. Almost some could be overwhelming at times, like where do I start? So we'll start to at least inform you of these are some of the options that are out there. And we could sit down one-on-one and figure out what makes the most sense to, from tonight, where do we go from here? So this is very informative. This is like the 10,000-foot view talk tonight, and we're just going to be, in general, these are the things we want to be looking for. And microbial imbalance, which seems kind of odd. This is a lot of GI issue, but if you have a lot of gut dysbiosis, been on a lot of antibiotics, I've seen this before in the consultation booth. Patients will have an infection, which is a stressful situation. They'll go on a bunch of antibiotics to clear their infection, and maybe not right away, but a short time afterwards, they start to feel crummy, and they complain to me that now their nails are breaking, their skin is dry, their hair is thinning and falling out. I've heard that story many, many times over the years. And so looking at your gut health can actually be related to your hair health, which it might not be, it's not the first thing I think of if my hair was falling out, but I think of stress, or hormone imbalance.
Dan, what about thyroid?
Yep, thyroid's in there with, well, maybe it's not in here directly, but we'll talk about that in a few minutes too. Definitely, if thyroid is off, you're gonna have a hard time growing hair and maintaining the hair that you have for sure. Yeah, because then you don't utilize proteins as efficiently as you should when you have low thyroid function, and you need, we'll talk about that in a minute too, you need protein to grow hair, plain and simple. So you can dose, give a patient, I'm just making up a story right now, but you can, let's just say somebody's low on protein or they're vegan, let's use that as an example, they're not getting enough protein in their diet. You can give them a supplement, I point over there because our amino acids are over there, of like branched chain amino acids or just an amino acid blend, and give that to them, give that supplement to that patient between meals, and you can see their hair grow back very nicely, just with protein, just with amino acids. Sorry, I'm digressing. I got to stick to my slides here, but we're going to be here all night. So. All right, so let's get into genetics here. And I am going to have to stop. Okay, I have a little timer going because I have to restart my little video camera every 30 minutes. So I'm just going to read this out. So genetics plays a role, is one of the biggest roles in hair loss. So hopefully that's new information for you tonight. So we'll talk about this test more in detail. Certain genes can predispose people to earlier and more aggressive hair loss. Genetic testing is a great way to identify causes and possible treatments for hair loss. I just talked about this 5 minutes ago, but the company that we partnered with is Fagron. They've developed a test called the TrichoTest. We have those kits here for sale at the pharmacy. We'll get into pricing and all that towards the end of the talk. And again, it's assessing variations in genes linked to hair loss. So they've identified the genes that are related to hair loss and hair growth, and they'll tell you if you've got the genes, if you've got certain, they call them SNPs, which is just a gene variants, I'll call it. I don't want to call malformation, but gene variants that may predispose you more to hair loss. And so with that then, and then what they can also do, and what they have done, is they'll take genes and show you which drugs that will work better based on your DNA, which is very helpful for me as a pharmacist. I don't have to sit there and guess which drug is going to be best to put in my hair solution for you, or to basically, I should be careful with what I'm saying, to recommend to your doctor to then prescribe that I can make for you. So the test identifies mutations that, I just said this, didn't I? I always get ahead of my slides. I am so sorry. I'm going to read this anyways, because for the people at home and for YouTube, but the test identifies mutations which may predispose people to decreased levels of certain vitamins and minerals important to hair growth. Oh, the cost is on there. I put it on there. There you go. It's around $250 for the Tricho test. It takes about 4 to 6 weeks to get back. And from that, you're going to have this 10-page report, and you're going to look at it like wide-eyed, like, what do I do with all this? And then I think the last 2-3 pages of the report, they're going to have basically sample formulations that I would then fax to your physician and say, Mrs. Jones, this is her genetic makeup for these SNPs. And based on her SNPs, based on her genetic profile, I'm going to recommend, I'm just going to make something up right now, but I'm going to recommend minoxidil, L-arginine, and dexpanthenol, which is a formulation we've made recently. We'll talk about dexpanthenol in a minute. And we're going to put that into a hair serum for you. You're going to put that on every night before you go to bed, and that's going to regrow your hair. Boom. Simple as that. And then if we put it in something like Fomil, and I'm not, for YouTube, I'm not being sponsored by any of these companies. I should probably say that for the whole YouTube crowd and YouTube deal. But Medisca is another company we partner with Hair Care Solutions. They have a organic pea protein extract called Anagain, Anagain. It's the pea protein extract that helps, it's been clinically studied and proven to help regrow hair just by itself. So just the foam that's in here, without any drugs, can help regrow hair. So we use this as an additive to help with hair.
So
hair
once you
growth.
start using that product, you have to use it.
Yeah. So
Forever?
let's get that out of the way right away. So if you start using these formula in general speaking terms right now, but you start using these products to help regrow hair, you're going to get results. Let's say, I'm not going to guarantee anything. If you get results, when you get results, you have to continue to use the product. Now, I don't know the exact number. I haven't studied that yet. I should probably start doing that and start tracking patients. But let's just say you use this for 3 to 6 months, and average cost is, I got some as cheap as $50 a month, and there's some as expensive as $100 a month. You start investing in this, does your hair keep growing after you stop using the product? Right?
Yeah.
I don't know the answer to that.
How often do you use it?
Once a day, typically.
Oh, once a day.
Once a day. Mm-hmm. Some patients I've talked to, we've only been doing this for about, well, very seriously about the last 3 months. I've had this particular product for over a year. Most of the patients, I'll be honest, most of the patients I've spoken to, they have to keep using the product to see the results. So
If you stop, then
if you stop, eventually, yeah, because and I'm a huge anti-Band-Aid pharmacist. Like, I just want to put a Band-Aid on something, but in this case, this, for that particular, for this, what I'm talking about now, it is a Band-Aid approach to just growing hair.
Is it very different from Rogaine, which you have to keep using too?
So it depends on the APIs or the drugs I'm putting in it.
Uh-huh.
Some of the APIs, some of the drugs, if I can fix the problem, I say but if the body's going to fix the problem with the drug, then you can see lasting results, and your hair is going to stay healthy the way it is, if we've addressed the root cause. Some of the drugs I put in here are not going to address the root cause. We're going to talk about some more of the root causes in a minute, though. But when we go to full mill, yeah, the results aren't everlasting. We'll talk about other things that could be, though.
Is that based on what the cause is? So that's what you mean?
Yeah.
So if it's a specific cause, you might have to keep using it, but
That's
if
right.
it's not,
If it's a hormone imbalance, and we
once you
balance,
fix that, then
that's
you
right.
want- okay.
And, yeah. So, but that's, I mean, I want to talk into, I don't even know the term I'm trying to say right now, but be too in vain. But if we want results right away, I've got that answer for you, no problem. But it's going to be expensive. But if we really want to get to the root cause of the problem, that's going to take more. Yeah, there's going to be more time involved with the patient. I'm figuring that out with me, and kind of going through that checklist.
Okay.
And then, do you really want to make some lifestyle changes and things like that? If it's a detox issue and you're full of heavy metals, that's a long road to kind of figure out. Or if it's a thyroid issue and you're sensitive to gluten, you get to cut out gluten. It could be something as simple as that.
or like you said, a vitamin deficiency, and if
Yep.
you're young, or it could be a diet thing, and then.
Yep. It
and
could
then
be
if you
that,
change your diet, you wouldn't have to.
right. It could be that vegan patient that's just not getting enough protein absorption. Yeah. Could be very simple, but then at the same time, it could be you could have all the problems on that previous slide. Yeah. But from a genetic perspective, though, we now have a tool that will help me narrow down 50 drugs down to like 5 of what's going to work for that patient, which is really nice. So here, I could have given the whole presentation just on these examples of all these genes and SNPs, but here's one, not that this matters, but there's this TTPA gene. Don't even ask me what that stands for anymore, but it helps to build proteins, which binds vitamin E in the bloodstream, and that helps to transport it in and around the body into tissues that need it. So then vitamin E can be used in the body to reduce harmful oxidative damaging to cells. Hair follicles are susceptible to this damage and can benefit from increased vitamin E exposure. So if you have this gene that's mutated, you might just need more vitamin E. But how do we know that? Do we all want to just try taking vitamin E? Maybe half of you will have better hair, the other half won't, but or we can all just do the test and we can figure out right away who has that SNP and who doesn't. So mutations in the TTPA gene can decrease levels of vitamin E in tissues due to lack of effective transfer around the body. Supplementation with vitamin E may improve levels in the tissues that need them, and tissues, one of them being the scalp. So it can bring more vitamin E to the scalp. I put all the links in the articles and all that for those that are really nerdy and want to look this up and do all that. And there's other mutations. Let's just kind of go through some more of these. I just put a few on here because otherwise we'd be here all night. But the TrichoTest also tests for other mutations related to compounds that play a role in hair loss, such as vitamin A, vitamin C, and zinc. So again, do we need all those supplements? We may not. We could do a blood test and it may not necessarily show up that we're deficient in these, but are they being utilized in the right format? So that's where some of these genetic testings are going to start to open up that window and help us figure that out. So it'll help determine if supplementation or avoidance of these vitamins and compounds will result in increased or decreased hair loss. So you might be fine with your vitamin A, and then we don't want you to take more vitamin A unless you have that mutation. We don't want you to get too much vitamin A, or we know with zinc, if you get too much zinc, what happens is you offset your zinc copper teeter-totter, and then you don't have enough copper because you're taking way too much zinc. If you don't have enough copper in your body, you can't. You're reducing your body's ability for angiogenesis, basically creating new blood cells and new blood flow, and that's a problem. So you might say, oh, I'm just going to go home and take some vitamin A, some vitamin E, some more C and zinc, and my hair will grow back. Well, maybe it'll make it worse. So we got to be careful with that. And then the genetic tests can help us determine, do you have those SNPs causing your deficiency or not? So, I think I have one more in there. Okay, one more example. Vitamin D has been found to be lower in patients with alopecia or typically an immune type of hair loss. Supplementing with vitamin D is thought to help prevent hair loss through these immunological effects. So if you have that SNP, again, now vitamin D is good for a million different reasons, but is it going to help your hair grow or not? Well, if you have this particular hair loss autoimmune issue, let's look and see if you have this SNP first.
Is that a sun? Is that what you get from the sun? D? No?
Yes. Yep. I'm not going to talk about vitamin D tonight because that's a whole nother 2-hour lecture. All right, so here's where we can start looking at some hormone imbalances and say, do we have these or not? If we have the imbalances, we can fix them and our hair can go back just off of this. And then that would be a permanent solution that we wouldn't have to keep squirting this foam on our hair every night. So estradiol, and this is what I see just about every day. Estradiol and progesterone increase the amount of time that hair spends in the growth phase. So estrogen and progesterone are good for hair. But when we hit menopause, or as that wonderful picture there of birth control, that can suppress our body's production of hormones that we produce, and that can screw up our hair. Low levels of estradiol, I'm just saying this in reverse now. So low levels of estradiol and progesterone, well, actually not, but low levels of estradiol and progesterone can increase androgenic, or basically testosterone and dihydrotestosterone effects. So again, I think of that as a teeter-totter. If you've got enough estrogen and progesterone and your testosterone's here, your hair's fine. When you hit menopause, your estradiol and your progesterone drop, and now this didn't change, but comparatively, you've got more of it, and that sucks. And so now your hair starts thinning out. But the double whammy is that estrogen and progesterone keep testosterone in place, but now when this drops, this actually does go up. So that sucks even more. So you can actually give a woman progesterone. It'll help with a million other things in their body, but it'll reduce the amount of testosterone in their body and reduce the amount of DHT in their body, and then their hair thinning will stop, or it'll slow down just by giving them progesterone. But we want to test that to confirm that first. And the same thing with estrogen. I do want to clarify that I'm talking about bioidentical hormones here. So I'm not talking about birth control on the previous picture, because those are synthetic. You're not going to get the same results that you are with synthetic hormones as bioidentical. So Hyperandrogenism intensifies hair loss, so just excessive testosterone. Carol, you mentioned hypothyroidism. So when you're talking about hormone changes, if the other issue that comes into effect when, and I'll keep using the example of the menopausal woman, her progesterone drops during menopause, guess what hormone is needed to activate thyroid hormone? One of many. Vitamin D is one, but progesterone is the other. There's an enzyme in the body that converts inactive thyroid hormone called T4 into active hormone called T3. So if you don't have enough progesterone around, that enzyme does not convert as well. You become hypothyroid, and then what happens is your hair starts to thin and not grow as well. So you can fix hair loss with sometimes very simple things, or it could be more complex too. No. Progesterone and hair loss. So progesterone competes with aldosterone for receptor binding. So similar to spironolactone, it's a drug we use in many different issues, but I won't get into that too much tonight. Progesterone is an 5-alpha reductase antagonist, so it inhibits conversion of testosterone into DHT. So big picture wise, if my hair is falling out because I have too much testosterone and too much DHT, which we can measure with a simple blood test or saliva test, if we have too much of this, we can just take progesterone to lower testosterone and DHT. There's drugs out there with side effects that can do the same thing, but as a natural pharmacist, I'd rather give you something that's safer, like natural progesterone that's already in your body, and just increase that, which will help reduce the conversion of testosterone, which causes hair loss, but even dihydrotestosterone, which causes even more hair loss. I can just give you some progesterone or recommend it to your doctor to prescribe to you, and your hair loss can be less of an issue. So suppresses, I put suppresses or balances excessive testosterone and estrogen. Plus, yeah, not only does progesterone keep testosterone in check, but it also helps keeping estrogen in check too. So I don't want to increase your risk of breast cancer. I don't want to increase your risk of uterine cancer. And the list goes on. I mean, estrogen's great and all, right? But it's got to be the right type of estrogen. It's got to be in the right amount. And to help do that, progesterone helps to keep that in check. And progesterone goes on and on. We're going to talk about glycemic regulation in a few minutes, but it improves glycemic regulation and insulin resistance. I mean, there's a whole issue with PCOS, polycystic ovarian syndrome, and that really comes down to an issue of insulin resistance. And so I would recommend to the doctor to change that patient's diet, because they're more than likely eating too many carbs and refined carbs, and more than likely they don't have enough progesterone in their body. And so that's this hair loss in that particular patient is just a symptom of a bigger problem. Just reach over there and reset this. Did I lose anyone? No? So my takeaway on that is get your progesterone level tested if you haven't, and see if it's in the right spot. And then it suppresses cortisol activity, increases. So most of us that are stressed out, we have too much cortisol, and that causes our hair to thin and not grow as well. So progesterone helps balance out stress. It increases GABA, which is our calming neurotransmitter. And so I could raise my hand, I probably need some progesterone every now and then to just chill ourselves out. So, so all good things there. So I think this kind of summarizes it. So if we're losing our hair, our hair's thinning out, and we have not tested any of our hormones, we should do that. That would be, especially for a postmenopausal woman, I'm going to recommend, even for men too, actually, quite honestly, male pattern baldness. I want to see what their testosterone level is. I want to see what their estrogen and progesterone level is, and so forth, because if that is unbalanced, that could be contributing to part of their issue. So we've been using a company, ZRT, for 30 years now. They test hormones through saliva, through blood. It's a very simple test to do. It's an at-home kit that we sell here. It tests your estrogen, your progesterone, your testosterone, your DHEA. It tests your cortisol. So you can get a lot of answers just by doing a ZRT hormone kit. They also offer comprehensive thyroid panel. They offer a four-point cortisol test if somebody's really stressed out, and if they can identify that there was a certain issue that happened and then their hair started falling out because of a certain stressful life event or something to that nature, I'm going to have them do a cortisol test to see if their cortisol is way out of whack. Because if it is, then there's our potential problem right there. Let's fix that patient's cortisol, and their hair's going to start coming back the way it needs to. And then they have a very comprehensive thyroid panel. Unfortunately, most of the labs that I see that we don't do here for thyroid are, I hate to say this, but they're grossly inefficient. I usually just see a TSH, and that is just, in my opinion, a small window of what's really going on with that patient's thyroid issue. I want to see their free T3, their free T4. I want to see their antibody levels. I should add to this, I'd like to see their iodine level as well to really get to the root cause of their thyroid issue, which could be leading or contributing to their hair loss or hair thinning. So if you haven't had that done, might be something to consider. I put the price on there, $349. So, moving on, so we're kind of moving down towards that list of that checkpoint list that I had early on. So inflammation, I'm not going to spend a lot of time on this, but so if you have high levels of inflammation, that could lead to hair loss. ZRT offers another test for $60. You can measure high sensitivity C-reactive protein. I just had mine tested a couple months ago. Your ideal level for C-reactive protein is less than 1, and mine was 6. Historically, let's see, so I did that a few months ago. Prior to that, I had my C-reactive protein tested in 2018, and it was 0.3. And then previous to that, I tested it in 2015, and it was also around like 0.3 or 0.5 or something. But I did have there's a virus going around called coronavirus. Anyone heard of it?
No.
No? Well, anyways, I got this virus that's floating around, and supposedly it's a virus that's floating around. And I got that in December, and I might be part of that long hauler syndrome too that people are talking about. And so I think that's why my C-reactive protein's elevated. But I don't know, to be determined. But mine was 6, so that's explains some of my fatigue and issues that are going on. So that I call that if you're full of crap, if you're full of CRP, and that I was like saying, holy shit, I'm full of crap, then you probably want to do something about it. So I'm doing like Tariva, I'm doing a whole mess of things. But the point is, test it. If you've got a lot of CRP going on, that's not a good thing. One thing that this is a prescription only item, but I love low-dose naltrexone. I did a 2-hour seminar just on LDN alone. But that could be used to decrease inflammation and to help with hair loss and all kinds of inflammatory issues, autoimmune issues, and the list goes on. But that's just one of dozens of different options to get your CRP level down. Just eating I should probably cut gluten out of my diet. I am taking turmeric, vitamin D, trying to cut back on refined sugars and all that kind of stuff. But trying to get more sleep. All right, I'm not going to belabor the inflammation issue. Blood circulation. So there's a popular drug, Rogaine. I'm assuming most patients have heard of that. So if you have poor blood flow to the hair follicle, that can decrease hair growth and cause hair loss. And so there's topical minoxidil, aka Rogaine, that works to increase blood flow at the follicles. So we could use that drug. We have it in our lab. Your doctor could prescribe it. You could tell us to add it to this foam mill, but at a much lower dose than this. This is 5%. We could do 0.5%. Don't get any side effects. We just do a little bit. We can add a little bit of L-arginine, which helps with blood flow. That mixes well with the foam mill, which is L-arginine is nothing more than an amino acid. No side effects with that. There's a few other things we can add to it, and we could do that instead and see if you really have a blood flow issue, use something a little bit safer.
Does massage or any of those, that helps?
Oh, for sure. Yep. Anything you can do for that. Yep.
What are the side effects?
My wife's
of
watching.
Rogaine?
You should
Oh.
give me a head massage every night, babe.
What side effects does Rogaine have?
There's some Well,
A lot?
there's a lot.
Okay,
I'm not,
I don't
yeah,
know. Okay.
I'm
all
not
right.
gonna get into
That's
that tonight.
okay, I
I'm
don't
sorry.
know.
I'm gonna table
Just
that for
bypass
later.
that
Yeah,
one.
yeah.
It's okay.
My point on that though is that, but to kind of answer that is we can use a lower dose of that to avoid those side effects. Yeah, I'm always about synergy, if possible, and adding different natural agents to something to gain benefit. Yeah, and this kind of keeps going on here, but Dane Newville, our pharmacist, did a talk last month on nitric oxide. So if we have poor blood flow, something that simply, we can even all do this after the seminar tonight, is we have these little test sticks. You can spit on your, basically you spit on your, it sounds kind of gross, but you spit on your finger.
Do you carry those tests? Do you sell those?
We don't sell them, but you can take one home for free. Basically, you can get them on Amazon, but what I tell patients to do is just do the test. To be honest with you, it doesn't make sense to buy a bunch of them. Just do one here for free. And if you're low on nitric oxide, we should do something about
You're
it.
supposed to take it in the morning on an empty stomach, right?
Ideally, yeah. No, you can take it home and put it in a baggie, but you won't have the little. So on the bottle is the little color indicators, like a pH strip, and it tells you how much nitric oxide's in your blood. Most patients I've tested are deficient. Not all, but it's something that I've done it even during the day. And I still test low. I've done it in the morning. I still test low. Yeah, yeah.
Is it something you get in your diet or?
Yep, watermelon, best source of.
Really?
Yep.
I just read on line that said watermelon's bad for you. Of course, you can't believe what
Lies, don't
they
believe
tell
it.
lies. They say beets are bad for you, and other ones
Yeah,
says it's good.
Beets are good too for nitric oxide.
They say it's bad, you should eat it. They say bananas are bad. Another one says it's good.
All in context though, right? So,
Yeah, right.
I mean, I don't want you to eat nothing but watermelon, but you'll be going to the bathroom quite a bit too that way. But anyways, or you can take CitraNox. You can, gobble up 4 of these capsules every day and then do it that way. But yeah, from a natural standpoint, eat some watermelon, a little bit of watermelon every day. Beets are fantastic for nitric oxide production.
Does it bring your sugar up?
Well, so there's the downside, right? So
Yeah.
then, where is your insulin resistance? Are you overweight? Are you diabetic? So I don't want you eating a bunch of watermelon and beets every day if you have a blood sugar issue. So yeah, so everything is in context of the patient. Yeah, we gotta look at all that the same,
Is that
right?
different if you take the supplement?
So that's the cheat. But do you want to buy some watermelon for $7 or do you want to spend $50?
Yeah, but I'm saying if you would have other issues.
Yes, then I would go. If you have, yeah, exactly. So. Yeah. All right. So this was Joy, who is now 3, but
Oh,
this was a while ago. I
Mhm.
took that picture. It must have been about 3 years ago now. So stay focused. We're halfway through it. I feel like I'm yammering way too much tonight.
What does that baby have to do with the picture?
Just
You have hair?
she has a lot of hair. Yeah, beautiful hair.
I can't see it.
I know.
What's your secret?
Yeah, why are some babies born with a lot of
I have
hair?
no genetics, right? I have no
You
idea.
don't know?
She had a-
What's that?
She had a ton of.
I tell of hair, yeah.
There's a ton of hair now.
So I think I'm halfway through my slides and I've been yammering for 40 minutes. All right, we'll speed it up a little bit. Stress, yeah. This is a killer. It's gonna do many things besides lose your hair. So it affects the growth cycle. So cortisol, as we get stressed out, our cortisol goes up. As we remain stressed out, we get cortisol, fatigue basically, where we just don't produce it anymore. Adrenal fatigue. Sorry, I said cortisol fatigue, adrenal fatigue. And then your adrenals get essentially burnt out. And I'm not going to get into that tonight because that's not what I just said isn't completely accurate, but we're just going to call it adrenal fatigue for simplicity's sake right now. And so your body stops producing cortisol. But when you are in that high stress level mode and you're just producing cortisol and you're just burning the candle at both ends, among other things, your immune system tanks, your digestion gets worse, you can't fight off infections as well, and you stop growing hair. So at high levels, cortisol reduces the production of skin elements, proteoglycans, and hyaluronin. So hyaluronin, you're familiar with like hyaluronic acid. It's in a lot of cosmetics for fine lines and wrinkles. That's what we're talking about here. But hyaluronic acid or hyaluronan is a compound that holds onto water. So that's why it's good for wrinkles in the skin, is because you put hyaluronic acid on your skin and it sucks all the water or pulls water into itself, essentially into the hyaluronic acid, and gets rid of the wrinkles. Or you put it on you make this yourself, your body makes hyaluronan, gets into your hair follicle, and that pulls water into it. So the more cortisol we have, the less hyaluronan we have. The less hyaluronan we have, the less moisture content we have. So what do we do? Decrease. How do we get rid of stress? We're not going to spend all day talking about stress, but things that we can potentially control is get rid of your concentrated sugars. Stop drinking 3 pots of coffee a day. Stop smoking. Reduce your alcohol. Get rid of your allergenic foods. That could be a stress on your system that you may not even know about. So get rid of your hydrogenated fats, artificial sweeteners, overtraining. So be like marathon trainers or triathlons. So you got to be careful with that. Inadequate sleep. I mean, I think I could check half the boxes on that list, unfortunately. I don't overtrain. I don't have that one, but I'm guilty with some of those other ones on there. Ensure proper hydration. Drink at least half of your body weight in pounds, so in ounces. So I'm 180 pounds. Divide that by 2, that's 90 ounces. Divide that by 8. I don't know what that, I lost track of my math. I don't know. I drink nine glasses of water a day. I think I drink 3 at best. I don't know. I should be drinking more water. Plus, I do drink about a pot of coffee a day. Reduce your blood sugar levels by eating low glycemic foods, a well-balanced diet, vegetables, meats, healthy fats. Consider nutritional support if needed for glycemic regulation. I do, every now and then I get on a kick for Glycemic Core. So if you're just running around busy, what I like to do is do like 2 scoops of like Glycemic Core, just as like a meal replacement, essentially. It helps balance out my sugar, gives me sustainable energy. You can even add more protein powder to that if need be, or the branched chain amino acids. You can just add a dump of that into Glycemic Core, make yourself a shake, throw in some frozen berries or whatever you want to spice it up. There's all kinds of recipes out there for Glycemic Core, and keeping your blood sugar more even keeled is going to keep your cortisol more even keeled. So, or you can go all in and do like dioxanol and CM Core to help with blood sugar regulation. And again, that's a whole nother talk in and of itself, but that helps to regulate blood sugar, which then helps to regulate stress. And then we have more hyaluronic acid in our hair. And I'm just going to skip over this, just other recommendations to exercise, breathe. There's a whole book on breathing that I've read. James Nestor wrote a book called Breathe that I'm reading right now. It's fantastic. Wim Hof's got a book called The Iceman, another book just on breathing and relaxation that I've read. It just helps to turn on your parasympathetic nervous system and turn off your sympathetic nervous system. So I'm always in that kind of fight or flight mode throughout the day, putting out fires, like 8 o'clock in the morning when I get here till 6 o'clock at night. So I've learned to meditate, I learned to breathe, chew my food, that helps. I love this one, taking time off each week to relax. I laugh at that one. Oh, that would be great. I'm not going to come in tomorrow. Awesome. You guys would not be happy with that. Who's going to fill your prescription? Half of you will get your prescriptions. The other half are going to have to wait till next week. Nutritional support. I'm going to kind of skip over it. But the fatty acids, phosphatidylserine. I'm just going to leave this. If you want to pause it on YouTube and look at it, you can. I'm going to try to speed this up a little bit. There's a great, I will stop at this. So nutritional support or for stress reduction. I love, it's called NuAdapt. It's got a bunch of adaptogenic herbs to help reduce cortisol. I personally have taken takes a few days to kind of kick in to feel that benefit, but it is something that if you're looking like, there's so many supplements and adaptogenic herbs to help balance out your cortisol, and New Adapt is a good combination product. And again, how do you know if you even need that? Well, go back to ZRT, spend $135 for a 4-point cortisol test, spit in a tube in the morning, before lunch, before dinner, and then spit in a tube again right before you go to bed. Wait about 3 to 4 weeks. Monica's going to write up a report, tell you if your cortisol is in the right range or not, and then give you 3 pages of recommendations of if it is unbalanced, what you can do about it. So, all right. That's probably if somebody's stressed, if you know somebody's stressed out and their hair is falling out because of that stress, I think I would start with a 4-point cortisol test. That'd be, I think, a slam dunk. Pollution, I'm not going to spend, again, we can spend 2 hours talking about detox tonight too, but if you know somebody that, maybe works in an industry that, like my dad worked in machinery for 40 years, he's probably full of heavy metals. He was a die caster with aluminum. I'm surprised he doesn't have Alzheimer's right now, but I'm sure he's full of heavy metals, all of the degreasers, and I went to his work a few times, and just the machinery that, and the chemicals that you're exposed to in like manufacturing plants, horrendous. And he was a cigarette smoker for 40 years too. But sorry, Dad, I'm ratting you out right now. Anyway,
He's still alive?
He's still alive, still kicking. Yes. Yep.
Like
His
my
birthday was Monday. Yep.
Like my
72.
grandfather, he did the same thing, smoked and drank, left to live to be he's 92.
No. Anyway, so pollution, if that's maybe you or someone do it. We have like a detox questionnaire you can fill out and see how toxic you are or not. Maybe consider doing like a Core-Restore Detox Cleanse. I usually recommend doing that at least twice a year, even if you're feeling good. Just like an oil change for your body. So skip over that. Low levels of vitamins and minerals. So this is where Fagron has the TrichoTest, and they have. Do I have the name? I don't know if I have the name of it, but I think it's called the NUTRI-GEN Test, and it tests the patient's SNPs for all of the vitamins. So the TrichoTest is the genes to tell me or your provider which pharmaceutical drugs are going to work for your alopecia. And then, so that's the TrichoTest. I'm going to call it the NUTRI-GEN Test because I don't remember the exact name for it. Same company, Fagron carries, or we carry it. That measures the SNPs for your vitamins and minerals. So as previously mentioned, there's various vitamin and minerals that can contribute to hair loss, which reinforces the recommendation for NUTRI-GEN testing, as shown before. A multivitamin may be ideal for patients looking to get several different vitamins and minerals without taking multiple capsules or tablets. Like Alpha Base is a good one. There's another one that we sell called Trace Minerals. And sometimes you need silica. Like if somebody needs just a trace mineral, switch your water to spring water, and you get enough silica that way. That can be an issue.
What about iron?
Iron, yep.
I mean, you need iron
you
for
need
hair,
iron.
but then you don't want iron for dementia and Alzheimer's.
It's a
right?
I'm glad you brought up iron. Iron is like Goldilocks. You don't want
Mm-hmm.
too much, and you don't want too little.
Yeah.
And you don't want to just do an H&H. If you go and get a regular blood test done, you're going to get just your hemoglobin and hematocrit done.
Yeah.
If you do that, in my opinion, that's not enough. You want to look at your iron saturation, and you want to look at your ferritin. That's the telltale sign. I look at ferritin levels on patients, or I have them go back to their doctor and request them to get their ferritin done. And I'm going to get off track a little bit, but you brought it up.
Well, it's important for hair loss. I know
It
that.
is. So, sorry if I'm dragging on, but if you have a patient that has low thyroid
Mhm.
and they are on medication and they're still not getting better, have them test their ferritin. A lot of times you want a ferritin level. I like it above 80. I know the range is something like 30 to 300, but having a ferritin level of 30, 40, or 50 in my book is too low for proper thyroid function and proper hair function.
Yeah.
Some doctors will disagree with me and say a ferritin of 50 is fine. But if I know that patient is symptomatic and their thyroid is still not working the way it should, I want to try to push that ferritin level up to about 50, or I'm sorry, 80. So,
Yeah. Thanks.
Yeah. Because when your H&H is like the last to go, it's your iron saturation and your ferritin, and those are that's your storage recognition. So I'd rather look at that. Is your stores getting low or not? Because if they're low, then that's a problem. Let's address it. Microbial imbalance. So again, I don't really think about my gut if my hair is falling out, but they are connected. Gut microbial imbalances can lead to hair loss. One mechanism leads to hair loss is antibiotic-induced dysbiosis. This I do see. So patient comes in, they just told me they had their 4th sinus infection of the year, and their hair is starting to fall out, and they feel like crap. It results in overgrowth of certain bacteria, lactobacillus, not that the name matters all that much, which can lead to depletion of biotin. So for our bodies so if you have hair that breaks a lot, you typically don't have enough biotin. So you can take biotin, right? That's a Band-Aid. What you could do, and then I'm gonna ask you a medication history. Have you been on antibiotics or whatever? You just have GI issues in general. Maybe you're on my favorite drug class, antacid. You're on a PPI drug for your heartburn, and you've screwed up the amount of Lactobacillus marinus in your GI tract. You need that certain strain of bacteria to activate the biotin. So again, do you want the Band-Aid approach? I can sell you biotin, for the rest of your life, or do you want to do a microbiome test, and we can actually see if that bacteria is living in your gut and at the right level. And if it's not, we can fix your dysbiosis by giving you strands of probiotics and prebiotics to increase this little animal so that it can start activating your biotin that you're getting from your diet naturally.
There's many
And then your hair stops
supplements out
breaking.
there, biotin, the high levels of biotin is supposed to make your hair grow.
But if you don't have this bacteria to activate it,
But if you take that all the time, then it should work, right?
it should, but who wants to keep spending more and more money on supplements? Yeah. I'd rather fix the root cause of the problem.
Oh, because that's just like a Band-Aid over it.
It's a Band-Aid, yeah. And again, I'm not saying it's wrong, but I also want you to know what the possible root cause of the problem is.
It could help, but maybe it's not a permanent thing, right?
That's right. And biotin typically is it's not for hair loss, it's usually for hair that just breaks a lot.
Oh, okay.
So there's differences, yeah.
Oh, okay.
Yeah, little nuances. Yep.
Is it okay to take those, you were saying
Probiotic?
like,
Oh, probiotic?
yeah, I take a probiotic regularly.
I do, yes.
Is that fine?
That's fine. Yep. And that's for a multitude of different good reasons. Yeah, for sure. Yeah. I know that. I'm glad you clarified that. Yeah. I would, yeah. Yeah, so reports biotin supplementation in cases of antibiotic-induced dysbiosis. Microbiome testing, which we have here at the store as well, $130. You can determine the amounts of microorganisms in your GI tract. And that's kind of neat too. It's measuring all the different, I shouldn't say all the different, I think it measures, I did this test myself about a year ago. I'm going to ballpark. I think they look at, 40 to 50 different bacteria in your GI tract and different fungus, different like candida and all that kind of stuff. And they can tell you, you got too much of this bug or too little of it. Yeah. Sounds great. It's a poop test. If you're wondering, yeah. Yep. We're testing poop around here.
Is that what you do? Is it like a slide?
It's what's that?
Is it truly like a slide?
Yeah.
Okay.
Yeah. Well, it's a swab,
A
and you
swab.
send it out. Mm-hmm. Yeah. Yeah. All right. Moving on. More testing. So I just said this. We have the microbiome testing. So if you have somebody that's been on a lot of antibiotics, or they just have a lot of GI issues, and they're reporting that the hair is falling out or thinning or whatever, they're having issues with their hair, they might want to come in. Hard to argue to just do a probiotic and prebiotic. You could try it, but if it doesn't work, then I'm going to tell you, okay, we should probably spend $130 and do the test, and let's just see what's really going on in your GI tract, because it could be even candida overgrowth. It could be even more extensive than just a hair issue too. Activator RX Scalp and Hair Serum uses CBDURL Pro complex to restore the scalp's microbial balance. I can't talk anymore tonight, or you could try this fancy serum, I guess they call it, and put this on your scalp and get the bacteria going in your scalp again to possibly regrow your hair. Another trick, I'm going to restart my camera again.
How often you put that on?
Once a day at night.
Do you use that along with the foam or just one or the other?
One or the other.
Which is the one? that-
If you've just been on like a bunch of antibiotics, then I would just do this one.
Oh.
Yeah.
I was only on one antibiotic, so that one.
That's okay. And the other trick you can do is take about, I can't remember the exact formula. I think it's a 1/3 cup of apple cider vinegar in about 1 liter of water. And then, has anyone else heard this before? And then massage that into your scalp, leave it in there for 15 minutes, and then rinse it out. Home remedy. Restore the microbiome of your scalp. Right, we're covered with bacteria. Our scalp is no different, and that's a good thing. We want good bacteria on our scalp. It's important for hair growth. So you can try that serum. You could do the apple cider vinegar trick. You could take some probiotics and try that. You could test your microbiome. A lot of different options that way. I'm going to skip over this. This was a slide on different pharmaceuticals that we would then use in your hair serums after doing the TrichoTest, the genetic test. There's finasteride, and there's that minoxidil again. Botanoprost solution. We've done a few of those before. I laugh at that drug because that's a drug for, the brand name is Zalatan, and it's back in my day when I was a new pharmacist, that was for eye drops for glaucoma. Now we're using it for hair growth. And I'm just
Is that the same as Latisse?
no, but yeah, it's well, maybe it is. I'm not sure.
It was some kind of eye drop, and then
Yeah,
that's what Latisse is, and I actually used it because my eyelashes fell out. This is
That
years ago. They grew back.
yeah, I can't remember the generic name for Latisse.
I don't know.
Anyways,
Okay.
yeah, it's just interesting how they keep repurposing drugs for, right?
Excuse me.
Yeah.
She said something about eyelashes. Does that have something to do with hair loss? Because my eyelashes, I don't know if they cut them off when they did eye surgery, if they've never really grown back.
I don't. Maybe the Latisse might do it.
What?
It's called
Latisse.
Latisse.
Is that
It's a prescription drug. It's a prescription
It's a prescription eye serum.
eye serum.
Yeah.
Yeah.
Did they grow back?
Mine did.
Yeah, it's over the counter now.
Oh, it is over the counter?
Yeah,
Oh,
you can
okay.
buy it
How
at
do you
Anton's.
spell that?
Latisse, and
Like
you can get
go
it at
to a
Anton's.
Beauty, like a spa.
Yeah,
and it has a
Anton's
doctor.
sells
You have to
it.
have a
Where's
doctor's.
Anton's?
Anton's, it's in Delafield.
Oh, okay. It's
I'll
not.
write it down for you.
They sell it
They
right
sell it
over the counter.
Oh,
Yeah, it's
there
over
you
the
go.
counter now.
It is over the counter.
Yeah,
There you
You
go.
can't get it at Walgreens?
don't know.
Is that how you spell it?
Yep.
L-A-T-I-S-S-E?
We talked enough about progesterone, but that is also a 5-alpha reductase blocking agent, which then reduces your testosterone. I think we talked about that already, but that's that one. So we actually put progesterone in this foam mill among a couple of other, we could just do it by itself, or actually I'm going to get to my next slide. Progesterone with melatonin. Melatonin grows hair. Now, it's not just for sleep anymore. Yep. Increases the growth phase of the hair follicle. It says in women, I'm sure it would work with men too, with androgenic alopecia. Topical melatonin has also been shown to decrease the severity of UV-induced erythema or redness kind of issues. And so we'll do melatonin, a little bit of progesterone. There's the pea protein in this already. And squirt that out, massage it into your scalp. It says to rinse it out in the morning. Most patients I've talked to, they don't even rinse it out. There's nothing to rinse out. The foam is I can show you real quick. It's
So the melatonin has to be in the scalp, it can't be if you take it internally?
correct.
Oh,
yeah.
okay.
But it's very, very light, and you just, I mean, if you can imagine rubbing that into your scalp, it's going to dissipate, and there's nothing to rinse out. It just feels like water. It's very smooth. You guys can, if you want to experiment on that after the seminar, you can.
Okay.
Now I'm going to grow hair. Good thing I already have hair on the backs of my hands. Oh, it's funny. All right, moving on. I'm a guinea pig for all this stuff, which is half the fun of working here. I hit on some of these home remedies already, but sea salt for trace minerals, cruciferous vegetables to help with hormone balancing. You got to be careful if you have Hashimoto's autoimmune issues, because that could be a problem. So, but I'm not going to get into that tonight. Brazil nuts for selenium. We didn't talk about selenium, but selenium can be important for hair growth. Get more sleep, get more exercise, but don't overdo it. That's for reducing stress. Drinking spring water. I think I touched on that because of the silica content in spring water. I'm wondering if my RO system pulls up. I have RO system here at the store and at home, so all I drink is essentially RO water. I don't know. Carbon filter in the shower, so removes fluoride. Fluoride kills hair. Well, I'm being a little bit over dramatic there. Let me rephrase that. Fluoride does not help your hair grow, period. So how much does it hurt it? Well, I'm sure there's a patient variance there. We have carbon filters on all the shower heads at our house. I recommend you get one. We use a company called Aquasana. It was recommended by a doctor. But anyway, so Aquasana is the name of the company. There's many of them out there. That's the one that I use. But do something on your shower head at home if you're having an issue with your hair. And so, yeah. And there's other reasons too. When you heat up water and there's another chemical, I'm not going to get into this either, but when you take a hot shower, there's a certain chemical that's released, and then you breathe that in, and that's toxic. And I can't remember the name of it, but it's horrendous. And so if you're just showering like with unfiltered water, I would strongly recommend you get some kind of filter for your shower head. Fluoride's just, again, in my opinion, and in many others, fluoride is not good for your scalp. It's not good for your hair. It's not good for your thyroid, because that fluoride pushes iodine out of your body, and you need iodine for your thyroid to function properly, among many other things. Sulfates, I'm assuming most of you know that. Maybe some people don't. Reminder, anyways, sulfates, sodium lauryl sulfate should not be in anything that you put on your body. So get rid of sulfates. Sulfates damage hair proteins. I just mentioned a moment ago about the apple cider vinegar trick. Oh, there you go. I put the recipe in there. I learned that from Dr. Berg. Third cup of apple cider vinegar with a liter of water. I don't know. 1,000 mils. I don't know how many cups that is. How many?
Give it that up.
Yeah, exactly. I know. Let that sit for 15 minutes and then rinse it out.
How long do you have to do that?
I go once a day.
Once a day.
Your hair?
I do it for like 2 weeks. Because if you think about you're trying to reestablish the microbiome, I do it for a couple of weeks and then stop and then see where you're at. Yeah, massaging the scalp, rinse out after 15. So we put packages together. So I feel like we've gone, when I started preparing for this talk, I didn't think I would fill up 10 minutes of time, and now I think I've been yammering for an hour. But so we put these different packages together, depending on what you may think you may need. So there's a TrichoTest, there's a consult with me or Monica, there's 3 bottles of CitraNox. Cost is obviously we're rounding numbers here to keep things simple, but $600. We're taking $100 off of that. If you want to buy this package, you could just do that through our website. You could just do that. You could just say you want the TrichoTest package, and then our website's being redesigned right now, so you could use this and it might be 6 months to a year. I'm not going to put a time frame on it, but we're redoing our website where you can then put in promo code. So if you go to our website now and you go to our, I want to say it's the order supplement page, you could just type in promo code test jeans, and then we will give you $100 off of that package. And so that's someone this test would be, or this package would be for somebody that wants to do that genetic test. That's really like if you want to get down into the weeds of what are the 3 to 4 drugs that I'm going to put in your foam mill, or we have other serums too. This is one of probably 5 different carriers that we have for product. But if you think that's the way you want to go, then I would do the TrichoTest, and then you can just order that through our website, use that promo code, and then you get $100 off of that. So that's the TrichoTest package. If you feel you're more of the hormone imbalance side of things, and that's why you're losing your hair, then we've got this package. So you get either the male-female profile. There's profile 1, 2, or 3. One is the very basic one where I'm just going to test your hormones and your cortisol in the morning. You get a consultation, and then alpha base. So that's your trace mineral. Essentially, it's a multivitamin that you have to take 4 capsules a day. And everyone goes like, "What do you mean 4 capsules a day? When am I supposed to eat breakfast?" And so alpha base is going to get all those trace minerals in there as well. A true good there's no such thing as a 1-a-day multivitamin, in my opinion, in 1 capsule. Your body can't absorb all those nutrients in 1 little tiny capsule. So same thing though, $600. That promo code is test hormones. The NUTRI-GEN Test Package. So if you feel that you have, and again, this part of this is feel and subjective, you can call me and I can help direct you to, but let's just say somebody's been malnourished or they don't have a good balanced diet. They've had vitamin deficiencies in the past, something like that. Then I would direct them towards the NUTRI-GEN test. You're going to get that. You're going to get your crap test, see how much inflammation is going on. Consultation, that one's $575, $100 off with the promo code test nutrition. Somebody that's malnourished, a lot of inflammation, I would steer them towards this package. And then we didn't touch much on the detox tonight purposely, but somebody that has skin issues, somebody's got maybe autoimmune issues, mold toxicity, something like that. They've worked in an industry where there's a lot of chemicals and things like that. You get a Core-Restore kit, 14-day Microbiome Test kit, you get the poop test, consultation, and then 2 bottles of that Activator serum for more of a dysbiosis issue. Again, that promo code is testbiome. And then I think that was the last one. So those are all going to be on the YouTube. I'm going to, like I said, my contact info, phone number to the pharmacy. You can call or text my cell phone number. I roughly go to bed at 10 o'clock at night, wake up at 6 in the morning. So sometimes it's easier to get a hold of me direct to my cell phone. You can certainly call here, but a lot of times you're going to have to leave a message or I'll get back to you. And then sometimes I lose your message because I've got a million of them. So sometimes if you have a text and you text me, I'll respond to that usually a lot better. Yeah. All right.
Oh, we took it down in the story.
I'll go back.
Email.
Yeah, I know that is like the longest email.
I know.
Now, is that how we get this website?
For like the YouTube and all that?
Yeah.
Yes, if you email me, then I will send you links to the YouTube video. Yep.
Wow.
Or if you just text me your email address, I will send you a link right to the video too. Yeah. You could find it, honestly. So tonight's all been recorded. You could literally go home, you can go in the parking lot and start rewatching tonight's talk if you want to. How many people tuned in? We got 1 left. All right. I'm going to stop this. And then